Let's get an update now on the Western Cape Premier Alan Winde and his health province MEC Nomafrench Mbombo expected to conduct an oversight visit to the Stellenbosch Hospital today. This forms part of the provincial government's plan to monitor hospitals during the second wave of the coronavirus. Newzroom Afrika's Athi Mtongana joining us live now from outside the hospital. Athi, good morning to you. Reporting this morning, as you heard in that intro, that the Western Cape is leading in as far as the COVID-19 deaths are concerned. I'm sure this is going to also be uppermost in the minds of officials who are going to make rounds to that hospital today.
Of course, Polly, that is on the mind of health officials who are working around the clock in the Western Cape to assess the situation at hospitals and just generally to look at how the second wave has been treating this particular province, which we all know has also been marked as a COVID-19 hotspot province. Hence those deaths that you speak of, where the Western Cape is unfortunately leading. So you may recall that in the past couple of months, in the past couple of weeks, that the Western Cape has had hospitals reaching about 90% capacity, and as far as admissions are concerned, something that was obviously worrying healthcare workers not only in the Western Cape. You might have seen the pressure from healthcare workers even expressing the sentiment of fatigue and just frustration, especially during the advent of the new variant. So what health officials in this particular province, of course, the head of a health department in the Western Cape, the Premier of the Western Cape, the MEC for Health, Nomafrench Mbombo, what they've been doing as a province is to try and plan towards the future. So, for example, in this particular hospital in Stellenbosch, we know that they might not have had as many numbers in terms of admissions as other district hospitals have seen, but what they have done here is to add additional beds, in the likelihood that they might again experience that peak in admissions like we've seen in other districts within the Western Cape. So they've added additional beds here at the Stellenbosch Hospital, which is essentially what the MEC together with the Premier are here to assess. Also bearing in mind that other hospitals like places like Khayelitsha as well as Mitchell's Plain there, what they've done in those particular areas is to add field hospitals. So they would erect tents outside of the hospitals or within the hospital premises just to ease the pressure from the actual hospitals, which were known as severely strained, especially during the second coronavirus wave.
Yeah, Athi, this being an assessment visit, I suppose, to that hospital by the Premier and his MEC. I can tell you in Gauteng, the Steve Biko Academic Hospital, for example, it's overflowing. They have had to erect tents in the parking lot just to try and add the wards, if you like. How is the situation in the Western Cape looking?
Well, remember, the second variant is not something that's only affecting particular province. This variant was located locally in South Africa. So at this point in time and looking at the levels of lockdown at which the currently is in, you might know that people are traveling. So it's not just Gauteng. We have heard the same sentiments being echoed here in the Western Cape. Hence, like I've said to you, where we've seen tents erected, filled hospitals, so to speak, at places like Mitchell's Plain and Khayelitsha. I mean, there were areas within the hospitals that people were saying in the Western Cape were being converted towards areas where people are supposed to be waiting to be admitted and to be assessed by healthcare workers. Some of those areas have had to be converted into wards. That speaks to the pressure that hospitals have been really under, having reached about 90% capacity in terms of admission. That speaks to, of course, the fact that this province alone has over 40,000 active cases and over 8,000 deaths. And of course, what you mentioned also speaks to what we've been seeing in terms of the movements of people in this particular province. The fact that this province coming out with the latest reports of having the highest deaths. We've seen this even during the first wave, Goli. And so to experience this again in the second wave, health care officials, particularly people like the Premier and the Health MEC, will have to really keep a close eye on in as far as trying to see whether the additional help and the additional services that they're putting at these hospitals is actually working.
Athi Mtongana live for us outside the Stellenbosch Hospital. That's where the Premier of the Western Cape is expected to visit and make an assessment about how that hospital is coping